Good morning, everybody. I am Dr. Lakin Seconds, and I will be facilitating a conversation today. As we know, the NHI bill was passed on Wednesday, the 15th of May 2024, by President Cyril Ramaphosa. And today, this webinar seeks to unpack what the NHI is and its impact on the healthcare sector as well as ordinary South Africans. Today, I'm going to introduce you to our speakers. We have Mr. Tobani Mtetwa. He is a researcher from master's degree from the University of Pretoria titled "The NHI is an Alternative to Developing South Africa's Healthcare System, a Retrospective Policy Analysis." We also have Mr. Nape Masipa from the Black Lawyers Association and Dr. Gloria Matapo, which is a medical practitioner. So today we're going to start off the conversation with Mr. Mtetwa, unpacking the NHI bill and its impact of the quality of care that people will receive. Sir, you have the floor.
Uh, okay, good morning to everyone. Hope everyone is well today. So, just to start off with the origins and the history of where the bill comes from, the bill initially finds itself from different series of conferences, events that have taken place, not just in the country alone, but globally also to transform healthcare across the world. So the NHI in South Africa, its main ideas come from the Dr. Gluckman Commission of 1944, which found that healthcare at the time was rising in the private sector and the public sector was also underfunded and overwhelmed, of which it's still even a crisis today. But even in 2007, when Resolution 5453 was passed at the African National Congress conference, elective conference, it outlined that there is a greater need to begin the process of developing a mechanism and a policy that actually aims to achieve universal healthcare coverage for all and also improving the healthcare of all citizens. So also the NHI can be traced to the Sustainable Development Goals of 2015, where universal health coverage became a discussion for many countries. I think it was under SDG 3 to ensure that to guarantee the right to health and well-being for all citizens at the time. So in its form, the NHI can be defined as a policy, or others call it a scheme, that is aimed at bridging the gap between the public and private healthcare sectors. So, between bridging this gap is to ensure that there is universal healthcare for all, and people that can access healthcare in areas nearby clinics or public general practitioners nearby to them. So this means that healthcare can be accessed at any point for free, and government is responsible for making the payments because it serves as a single purchaser in a strategic form and is also publicly administered. So this means that it doesn't mean that there is an end to the private sector, but it means that the healthcare sector, the healthcare system in its entirety will be overseen by the government. So the benefits with the NHI is that basically it's relieving financial hardship also from those who are paying current exorbitant fees for medical aids, and also to address the challenges of I'm looking for this correct word that I want to use. Is to address the burden that is faced by the public healthcare sector, uh, which is also constrained by a high demand of people who require access to those particular facilities. So I think we've all seen and heard of the greater challenges that are affecting the public healthcare system. It is normally long queues, shortage of equipment, shortage of resources, human resources, capital resources at best, also beds, many issues that we have heard of. But however, at certain points, you'd go, for example, let's say there's Bara, or let me just make an example of Tshwane where I stay. There's Steve Biko, there is a med clinic nearby. So you'd find that there are more patients who are waiting for a dialysis machine at Steve Biko, where else at Mediclinic, the machine is not in use and there is less patients. So also it's to spread about people to get access to the particular healthcare resources at the correct and necessary time, and this will also reduces the rate of mortality in the country, because if a person was able to access a particular service on time, they're able to get the help they need, and this decreases their chance of getting further ill also. So, in its sense, it's basically saying that we need to give access to healthcare to all people, and as the government, we will be responsible for making the payments, and at the same time, also, uh, it's also redressing the historical imbalances that were created by the spatial divides, the apartheid legacy in the state, also. So basically, the NHI also, to a certain extent, it's presenting the socio-economic vision for South Africa, because also we have to take into consideration that our healthcare if has an effect on the economic system, and the economic system also has an effect on the particular healthcare system that we have, on the healthcare that we have. So if you're not healthy and you're not getting the help, the necessary help you need, you cannot play a role in the economic system of the country. And if not playing a role in the economy of the country, it means then there is less development. So that is why healthcare is such a priority. So the discussion was that at that time, universal healthcare then becomes a priority, because we have to bridge the inequalities that are existing across all areas of society. And the most crisis has always been accessibility for those who do not have, and then also the crisis with those who can afford to pay for healthcare. It's that they are now being overexploited, overcharged, and there's greater disparities economically in the healthcare system, and this has led to financial hardship for even those who are on medical aids, and it has created the system of out-of-pocket payments, whereby people, I think we've seen over the years, people sell their houses, properties, and also like use their savings to cover healthcare costs, of which it is not fair. It doesn't guarantee the right to life, because if you are now paying exorbitant fees just to breathe, what then happens tomorrow when you no longer have the funds to particularly pay for it? And at the same time, once a person has actually depleted their particular human resources that they have saved up, it creates a situation whereby they also have to now go back and rely on a public healthcare sector that is at the time overburdened and overwhelmed. So basically, the two sectors themselves, they they are mutually inclusive. They are dependent on each other. That is why we are then for saying that the NHI then aims to bridge the gap between the two sectors, and to ensure that everyone has access to healthcare services, and also at the same time ensuring that people are not affected by financial hardship, and it offers them a financial risk protection. Thank you.
Okay, Mr. Mtetwa, wouldn't fixing and improving South Africa's public healthcare system be more of a feasible solution?
Okay, there has been that argument to say that the public healthcare sector has more challenges than the private. It is a discussion, but for what we found at the time, I think even the competition commission or something that was analyzing the rising cost of healthcare in the country, also found that now it's just not a matter of fixing infrastructure and just putting in human resources alone in the public sector. That was just a crisis. Also, people who are on medical aid subsidized by the government itself are in trouble because of the rising healthcare costs that are not regulated. So, also just focusing on the public healthcare sector alone doesn't address the entire challenges in the healthcare system. Because, for example, a Gloria who has a medical aid has access to the private healthcare system subsidized by government. Later on, finds that she cannot afford she cannot afford to keep up with her medical fees at the private facility. It becomes a challenge because these fees were becoming unregulated, uh, and healthcare now for them had become more about profit maximization. So it doesn't entirely address fixing the public healthcare sector alone doesn't entirely address the challenges in the South African healthcare system. Yes, to invest in infrastructure is very important, and it's currently outlined also in the NHI bill to say that whilst we're in the gradual process, the slow process of implementing the NHI, we will be investing more on on fixing the public healthcare system sector. I mean, and also trying to spread out people to promote access to healthcare and ensuring that the right to life is guaranteed. So the question of saying that the focus should be on the public sector alone, it's it rather limits then the purpose of universal healthcare coverage on its own, because it's saying rather fix that first, but this has to continue. So you are focused on the public healthcare sector alone, whilst also there is further injustice being done to those who are accessing the private healthcare system.
Okay, thank you, Mr. Mtetwa. Are you with us?
Rising costs challenges that face both, and also we know that there is a single person that is responsible for the entire process, and it lies in the government, and it is regulated. And also any challenges that come about in the healthcare system as a whole are addressed by the different commissions and committees that will be set up when the NHI starts to finalize its governance structure. So fixing the public healthcare system doesn't entirely, for me, it doesn't entirely address the challenges in the healthcare system, because also the more that you focus on the public healthcare sector, there is negligence on the private side and less regulation on how they conduct themselves. So there is a greater need to place emphasis on fixing both. The other ones is affected by deeper social issues and infrastructural challenges, where else the other one has been less regulated. And at the same time, it's subsidized by government. So therefore, why would it then not want to cooperate when it's actually enjoying certain benefits of the South African taxpayers themselves? So we have to create a system that is coexistent and it's able to work with each other to address the perils facing the healthcare system. Thank you.
Thank you, Mr. Mtetwa. Dr. Gloria Matapo, we move on to you. So, what does the bill mean for a healthcare practitioner in South Africa? As a professional healthcare practitioner, what are your views and feelings over the new NHI bill that has been passed?
Good morning. Thank you for having me. I hope everyone can hear me. All right. I think fundamentally we agree that there is a lot of inequality outside of healthcare, just in the country. We see quite a lot of inequality, and you see the disparities that exist as a sick person who is poor compared to a sick person who has money, and as people who are in a space who believe in the right to life, your right to life should not be governed by how much money you have. So I think in general, the logic behind the NHI is very commendable, and all of us in the sector understand where the logic and the principle comes in. I think a lot of people in the health space are worried about implementation, as well as the current issues that we are facing in the healthcare sector. If a funding model, because essentially the NHI is a funding model, it's a pocket that will obviously be managed and structured. In the same way that medical aids basically are structured in this day and age, where a patient goes in, they see someone on a primary level, the person on the primary level then sends them to a specialist. That specialist gets authorization from the medical aid, then the patient can go and see that medical aid. Yes, the turnaround is much faster with the medical aids that we have. You get authorization within a few minutes for patients, but generally the thinking is the same. The problem comes in, number one, where you need to get a buy-in from the private sector that doesn't have a tax or a fund pocket, basically, where they pay their salaries from, right? So private sector gets their money from, day-to-day business. And so if the business is not running, it's not going to work. So the biggest thing is, do you get buy-in from GPs who basically need to still maintain a certain level of patients that they see in order for their practices to thrive? In a specific area, people already have relationships with their primary healthcare providers. How do people feel about moving away from primary healthcare providers that they're used to now a totally different person? And we also know the lines, the waiting, the queues that exist in our clinics and our basically our entry points of care already in the public sector are so overwhelmed. What happens when a person who initially had medical aid, who could just go to their GP and then follow through with their disease? What happens when they're now dictated to by the bill that they need to go see a certain doctor or a certain clinic and wait? What happens to waiting times? I think we also worry about the lag. So, will the lag affect how disease presents? Are we going to start seeing patients in the later stages of disease because they had to wait so long? I exist in a space where you'll find someone went to a GP and they complained of something, they did their tests, and they come in and we find that, oh, this is actually a stage 2, stage 3 cancer, and we're able to maybe intervene quite quicker. What happens when that specific patient who's so used to, or that pool that we used to get and receive without being in advanced disease, if you're waiting for authorization from the NHI and we see you much later in your disease, you're going to cost more to treat you as a higher disease, a higher stage cancer compared to an early stage cancer. So there's a lot of clinical concerns that exist within people in the health space. And I think those clinical issues also look at how NHI runs internationally. We see a lot of issues in the UK. And I mean, our system is still quite a clinical system. I need to definitely commend our healthcare system in that our doctors still definitely diagnose patients and we still have a more clinical approach to how we see patients. Whereas overseas, you find that before a patient maybe can go for like a biopsy, they first need to go for a CT and all these other complicated things. But in principle, the waiting time that is seen in the UK, we probably will have that too. What does that mean for the actual outlook of healthcare? Is it not more expensive if we're going to start treating patients who are presenting much later in their disease? So those are the biggest issues that we have around the sector.
Thank you so much. And next up, we would have Mr. Nape Masipa. He is from the Black Lawyers Association. He's just going to give us what is the legal perspective on the new NHI bill that has now been passed. Sir?
Good morning, colleagues. Good morning, everyone. Well, I come from the Black Lawyers Association Gauteng branch, and I'm operating as the secretary of the branch. Firstly, the BLA has not adopted a formal stance on the bill as of yet, but one can deduce from the constitution of the BLA that the objectives of the Act and our aims and objectives, they do align. I think our objectives are in clause 5 of our constitution, where it says to say we are an organization that will uphold, protect, and advance human rights, civil liberties, and rule of law for the politically, socially, and economically marginalized, fight and challenge all discriminatory practices. So we take a stance in terms of South Africa being the most unequal society in the world, and healthcare being the great social divider in terms of the haves and the have-nots. And we say that the aims and the objectives of the Act, they do align to the aims and objectives of us as an organization at this point. But obviously, it will be ventilated at the national conference in terms of what is the official stance. But from the constitutional aspect of our constitution, we do align. Firstly, now it's the NHI is law. Parliament is the most powerful arm of government. You've got the judiciary, executive, and legislature. And when legislature makes laws, it makes them they can come into force overnight. Obviously, there has been threats of litigation around the act, and we do anticipate a lot of opposition. And largely the opposition is around the finer aspects of it in terms of the interests of your medical aid bodies, and also generally people's own civil liberties to say they do not want to be subjected to this. But that we do anticipate that will bring us to, we will be in court for quite some time. Now, as an organization that represents Black lawyers generally, I can narrate to say that in the legal profession as well, the inequality that permeates in society, you actually do find it in the legal profession. For example, many of us that run our own law firms, we cannot compete in the open job market because there's a concept called benefits that includes medical aid and so forth. And that will always mean that the cream of the crop in the industry will always go to the firms that do have those capacities, and those capacities are built over years and years of generational wealth. And for the new up and coming lawyers generally, both advocates and attorneys, they do find it very difficult to access healthcare. And then the other critical component of it is that our profession is, and I don't know, I'm with doctors today. I don't know if they will agree or disagree, but our profession is ranked as probably the most stressful profession, one of the most stressful profession. And sharply, the issues of mental health have been raised in our profession in terms of how do we then get access to mental health care as legal practitioners. So basically, that is where the interests of the NHI bill or the NHI Act and us as an organization align to say we need to equate the playing field between various industries. I mean, the advocacy profession as well. When people start off their pupillage, basically they don't have access to healthcare, they can't afford medical aids and whatnot. And in fact, it might be a deterrent for Black lawyers to access that profession, that space in the profession, because one of the big issues, again, is the concept of benefits. And the profession will then be poorer with people that would have otherwise been dissuaded from joining the advocacy profession, and similarly to the attorney's profession. So that is in a nutshell a soft overview of the issues that we will be engaged in the upcoming national conference, in terms of how does the NHI Act advance our struggle for transformation in the legal profession. So I think that is, in a nutshell, our short overview.
Thank you so much for that. So now we are going to be responding to some online questions that any of the viewers may have for any of the speakers. So we'll give you guys some time to write out your questions, and we will start. Okay, so we're starting. So the first question is from Miss McDowell. As the government going to make means to help people with the funds? Are those funds going to touch tax increases? So any of the speakers, if you're wanting to take this question, maybe Mr. Masipa on tax increases.
Generally, government ideas require money to be levied. And then you would probably see the funding mechanism that is going to be implemented through the Act, which might include that aspect of levying higher taxes from its citizenry. But generally, South Africa is a welfare state. I mean, you look at the whole notion of the RDP. RDP is just to bring the poorer people of our society in line with a dignified existence in South Africa. So equally, you will have the same mechanisms that are put in place when it comes to the right to attain healthcare, to say that obviously the haves will be levied to then bring closer to the have-nots towards a dignified existence. And healthcare really is a paramount and essential human right. I mean, you would have seen it during the COVID time to say, uh, you would not want to have a situation like that where an illness like that is floating around, and then the people that have got access to private healthcare, they are better off than uh, the people that do not have a right to private healthcare. And Section 9 of our Constitution says that we are all equal in all aspects of our lives. So thank you.
Thank you so much. Do we have another question? We do. From Bonolo, with so many doctors and nurses unemployed, why can't the government invest on that rather, as well as proper healthcare resources and right infrastructure? Maybe Dr. Gloria Matapo, what are your feelings about this question?
Hi, thank you for the question. Firstly, it is sad that we are very understaffed in the healthcare sector in South Africa and in the world generally. You know, there's a shortage of healthcare workers. But it is sad that there are health practitioners who can assist with the current burden of patient care. I mean, the ratio, the doctor to patient ratio, population to doctor ratio is actually ridiculous. I think it's 1 to like 1,000, or it's very high. You know, you can't have one doctor servicing 1,000 people. So I think NHI is part of um, solving the financial, the financial issues that are faced in the health sector, but that definitely doesn't mean that there are no issues in general. And I'm hoping that government is going to look at the other issues that we face. Issues like roads, certain hospitals just being so far away that they can't then access their nearest tertiary hospital. At the moment, being a person who works in Pretoria, you get a lot of influx of patients from Mpumalanga, Limpopo, and also foreign patients. So you're not just servicing your province, you're servicing many other provinces and many other countries essentially. Do we have the right infrastructure? Do we have enough people? So I'm assuming that the NHI bill is coming in to relieve the financial burden so that we can solve all the other issues. But I definitely want to mention that NHI is definitely, it's not the solution. There are so many other issues that are present in the healthcare space that need to be dealt with concurrently in order for us to really provide quality healthcare.
Thank you so much for that. Um, we'll just give it a second to see if there are any other questions. Somebody said, I'm worried that we will end up with the UK health system. Mr. Mtetwa, you were talking about the NHI bill. Could you discuss this one last question with us?
All right. Thank you. Just to first outline that we have to note that each country has its own particular problems, mechanisms, solutions to addressing their own, and each country also faces its certain economic challenges. It has different types of leadership and leadership skills. So it's quite an unfair comparison to compare what the UK has had over 100+ years to what South Africa is trying to achieve within the next couple of about 30 years or more. So I don't think we will get to that level where we'll just collapse before it even starts. And if we should face any challenges, we should have the right answers to it by the time, because there is collaboration and discussions on how to continuously improve policies and amend and fix challenges where they are structurally existing. And just to also add on to what Dr. Gloria was also outlining, is that yes, there's a greater need to address issues concurrently, and it's what the bill also intends to do. Although some are an immediate challenge and they have to be addressed now, It's also those things that make the bill come across to look as if it's not ready to be implemented fully. So there is a greater need for more dialogue, discussion, and also to just get more perceptions on what can be done to fix the immediate solutions, and also to make sure that once we know what's going on and what solutions do we have for the immediate challenges, how do we ensure that we've got preventative measures for future policy making and also for straightening of this particular policy or bill once it's fully implemented. So I think we cannot be forward looking to say that we might have the crisis of the UK. We don't know what the global economy might look like, and what a window opportunity for growth and sustainable development South Africa can particularly gain in the next years to come. Because policy making also is dependent on the ongoing global challenges. So a global economic challenge can collapse one country, but can also create an enabling environment for the other country to grow some way economically and then become better off. I mean, also just to make an example of why we cannot be forward looking. I mean, countries that were underdeveloped before the collapse of the global economy in 2008, there are actually countries that came out better and others came out weak from that particular situation. So, success of a country, its policy initiatives, its economic growth, it hinges upon what takes place in the global markets and how that would look for that particular country. So it's not a matter of today it's going to look like this, today it looks like this, tomorrow it might look like this. We are just not sure. It's a matter of what happens in the global arena and how does it affect us domestically, and how do we then navigate around making sure that we are successful within that particular context we exist in. Thank you so much.
Thank you so much, Mr. Mtetwa. I think we have one more question from one of the viewers. We'll give it a minute or two and then. So, Jazz asked, where does the NHI place the Medical Schemes Act of regulation of rates of supplies of service? Maybe anybody can answer this question.
Yeah. So I
Open to the
think,
floor.
am I still audible? So is something happening with my?
No, you're
All
audible.
right.
You're perfect.
Okay,
Thank you.
great. So there are prescribed minimum benefits that every medical aid should be catering patients who are on that medical aid scheme. And to be fair, we can also confidently say we've seen a lot of medical aids not adhering and not providing patients with what they need to be provided for. We've seen suspiciously patients having to pay a very big bill where a person's on medical aid, they're paying every single month, yet they're left with a bill post disease or post treatment. So definitely, what we hope is that we'll also see a bit more regulation, even with the medical health insurance space, where they themselves are more strict in providing minimum benefits for patients. You don't want to hear you need to do a procedure for a patient and then the medical aid says they're not going to cover it, and then there's these terms. I mean, we do see that, and we need to be honest, that the private healthcare sector and the medical health insurance sector isn't perfect either. There's a lot of cracks. So I do hope that this will enforce that people get and they are treated for all minimum benefits, both in public sector and private sector. So I do hope that we are stricter in implementing policy to look at both public sector and private sector a bit closely, to ensure that patients are cared for. I think there is also talks that NHI will obviously also regulate costings. I mean, you hear of patients being billed at 600% of their medical aid rates, and then they have to pay out of pocket, and that's expensive, right? You usually, when you're sick, it happens unexpectedly and no one just has money lying around. So we also know that with the regulation, there'll be certain pricing pricing points that are more regulated. You'll hear people saying that, people in the healthcare space want to make money, we want to buy these fancy cars. And I mean, you hear that, but I work in a government hospital. I see many patients anyway, so the narrative that a lot of us in the space are worried about our pockets isn't really a true reflection. And if the NHI comes into place, and it means that people aren't being ripped off for things that they're paying for every single month, then definitely we're for it.
Thank you so much for that. I would just like to thank every single speaker that spoke here today. Could everyone just leave us with a closing remark about the NHI, and what we have to look forward to? Mr. Mtetwa, would you like to begin?
Yes, I think as citizens, we all have a responsibility to play in the development of our country, and our pockets and our privileges should not blind us to what is needed. Although, yes, people are expressing their concerns and challenges on the particular upcoming implementation of the NHI, I think also we should look at it with a positive lens to say that if we all play a critical role in ensuring that it's successful and also it's implemented by the particular correct leaders that are aware of the challenges just not facing society alone, the challenges facing doctors, nurses, primary healthcare providers, and also what really takes place in the healthcare system, especially information must come from also those who are there on a day-to-day basis and also who know the challenges that take place within the hospitals, within the clinics. Because also in policy making, sometimes we are dismissive of the actual stakeholders who are with the day-to-day operations, and sometimes we tend to have a political outlook to how it's done. So I think at this time, the NHI requires a full stakeholder collaboration, cooperation from everyone who has knowledge on the healthcare system, and everyone who holds the belief that healthcare is a basic right. It's not for profits. It's something that everyone is entitled to. So it has to be implemented by the correct leadership. Because this is an enormous and massive task, we should all play a critical role in making sure that whoever is delivering it is held accountable and also really truly accounts and also is in line with the challenges that are really taking place and the practical challenges existing in the system. So we all have a critical role to play, particularly also because this is a global obligation that all states must meet, and it also has a direct effect on our foreign direct investments. Because if we're not investing in our healthcare system and making sure that people are fine, we're then not in line with global standards. So we all have a critical role to play in ensuring that
Mr. Mtetwa, are you there? Okay, we may have lost him. Dr. Gloria, would you like to give us your last closing remarks?
I think that we need to be honest, that medical aids or private healthcare, the private healthcare sector, was designed to service a very small population. And if you look at the amount of time that medical aids have existed, and this is even before democracy, you can imagine the amount of funding that has moved away from ensuring that the hospitals that service the greater population are taken care of, because now you have the people that you care about that are now being able to go and seek healthcare privately. So we can't deny the fact that there's an inequality that caused the rise of private healthcare and medical aid schemes. And putting that into context, the NHI is just a funding solution to a lot of problems that exist in the public healthcare sector and healthcare in general. And I think we need to all collaborate collectively, understanding the fact that we are already working, one down, because there's a lot of basically poor infrastructure investment that didn't happen because the people that were accessing public healthcare weren't really the important people. So I hope that this is an opportunity, number one, just to open up the conversation about the fact that patients that are in a public in a private healthcare space have like an atrium where they can go sit and look at the air. And I know it sounds silly, but they're actually markers that we look at in terms of patient health while they admitted, small things where certain people have access to better infrastructure to compared to other people. At the same time, we also have people working in the public healthcare space who are already overwhelmed. Does the NHI then open up even more patients that need to be seen in the healthcare sector that would have maybe been seen by another colleague? So I think NHI is just the funding model that addresses the funding issues and the monetary issues in the healthcare space, but there are generally a lot of other problems that we're going to need to discuss in order for us to move forward and see positive change in healthcare in general in the country. Yeah, that's my take.
Thank you so much. Mr. Masipa, is there anything you would like to leave us with?
Thank you, colleagues. My parting shot would just be that from a perspective of a Black lawyer, generally, the interventions and the aims and objectives are welcomed from my personal perspective. In that the challenges that we face in getting our lawyers access to healthcare. And like I alluded to earlier on, to say that you've got a rise of mental health illnesses within the sector. And it's very challenging for young advocates, young attorneys to access healthcare. And we think that the aims and objectives generally will bridge that gap in terms of making it an equal society and ultimately towards our main objective of transforming the legal profession. We will never be fundamentally opposed to, in principle, to aims and objectives that aim at equalizing society and helping the most marginalized people of our society, which is the poor, from access to a dignified existence. So for me, all of the objectives that are there, and then I agree with my colleague, Mr. Mteto, earlier on to say, if you read the Act, the ideals are very noble. And then you just have got these nitty-gritties that will be ironed out through the course of litigation that may ensue in the next few months or so. But generally, my plain reading of it is that it's a noble objective by the government, and then should it achieve that which it is aimed at achieving, it will make our society a better society. Thank you.
Thank you so much to everybody who attended or even just decided to watch today. I hope that everybody just has a more open perspective on the new NHI bill that President Cyril Ramaphosa has passed, and that we can begin to have more conversations about what the NHI is and what it would indicate for us as a country. Thank you so much for everyone who attended. Have a great day.